Welcome to Friends with Fertility, the podcast where we dive deep into the world of fertility, reproductive health, and all the emotional journeys that are in between. I'm your host, Elizabeth King, a fertility expert dedicated to providing you with the knowledge, support, and inspiration you need on your path to parenthood. Whether you're just starting out, exploring your options, or looking for solidarity and advice, we are here for you. Let's embark on this journey together and turn uncertainty into empowerment and make friends with fertility. Let's get started. Hey everyone, welcome back to Friends with Fertility. Today we have Dr. Roxanne Pero. Am I saying your last name correct?
You got it.
Okay, welcome to the show. For those of you who don't know, for all of our audience who may not know, can you tell us a little bit about your experience and your journey from Baton Rouge to becoming a physician? And I think you're from a family of physicians as well.
Yes. I come from a long line of what I like to call healers. I think too often in conventional medicine, we never confirm that we've healed or cured someone, right?
I love that.
But yeah, so my dad, my sister, most of my sisters have married physicians, so we've got the gamut. We're covered everywhere.
I would love to be a fly in the wall at those dinner tables.
It's wild. Yeah. My mom was a saint. She had 10 kids, all vaginally. Yeah.
Oh my goodness.
She's still very sane. I don't know how she did
Wow.
it.
Bless her.
But yeah, so I grew up in Baton Rouge, just destined to be a physician, no matter how hard I tried not to. And then made my way to Parkland to do my OB-GYN residency, and fell in love with just the act of taking care of another fellow female. It's just such a obviously intimate relationship. And I felt like I was really good at it. So I've been blessed to be able to take care of women for the last 15 years now. And it's only getting better each year, cool. Right? With all this amazing technology and interventions that we're able to do to help women.
Yeah. I just want to say, I love that you pointed out, like, I was good at it, because I feel like we don't say that about ourselves often enough. And, or if somebody says it about us, we kind of like, oh yeah, we put it down a little bit, but like, good for you for saying like, yeah, I'm really good at this. So I love that. I just want to point that out. So you've been open about your fertility journey. So what was it like to going from being on one side of the stirrup, so to speak, to the other, and kind of realizing, oh, this actually might not look like the way I thought it would?
Right? I think like all of us that go through infertility, you're kind of you're thrusted into it so quickly, and you're just looking at the finish line that you don't realize how dysfunctional or emotionally hard it is for you from the beginning. I think I expected, okay, yeah, I'm having fertility issues, and intuition, right? I talk to my patients a lot about that in my practice. I had that intuition that
you did.
I was.
Where do you think that came from? Like, coming from a big family, what most of us would think, oh, like my mom had it easy, this is probably going to be easy for me. What do you think it was that gave you that like intuitive hit that something might be off?
I don't know, but I know that I've had many experiences since then, really tapping into my intuition, and
amazing.
It's something that's beyond our explanation that I don't like to talk about too much because, right, it's not evidence-based.
Right.
But, I definitely encourage patients to kind of tap into that. But yeah, it was just something that was just always in the back of my head. I didn't want to believe it, but I started off on that journey, and I just expected that, A plus B equals C, right? I'm infertile. I find the best REI doctor. I'm an OB-GYN. Of course, he's going to help me get pregnant super fast. And then 4 years later, with so much heartache, and it's not until you look back at that process and you realize, oh my goodness, Like, yes, thank you for all of the amazing children that I got from this experience. But wow, I had a lot of emotional scars from that. So,
And not to get into those emotional scars, but just so that people can hear it from you, because I say this often, what is just another day in the office for the physician or the white coat is life-changing for us on the other side when we're going through it, right? They're like, oh, like there's no heartbeat, sorry, like out the back door, or, oh, sorry, it didn't take, or there's no eggs retrieved this time. So it's kind of a mission of mine for the REs to understand this is way bigger than what is happening in your day to day. And God bless them again. They're doing their job, and that's not part of their job. And that's why when they're partnering with people like us, it's really helpful because we can really mitigate that for the patient and their experience. But for you being literally on both sides of that, how did that change kind of who you are, and what was your experience in that through the journey of 4 years?
yeah, absolutely. Looking back on it, I realized how much, and I think that this resonates with everyone who's gone through fertility, how much you're supposed to be like the center of it, right? They need your body, they need your eggs, they need you to do these injections, they need you to do these ultrasounds. But how much you really feel like you're actually not a part of it. Like people are telling you to do this, you're going to these appointments, you're doing all the things, but you almost feel like a shell, like just a robot. And I realized in that experience, like no one talked to me about what I could do outside of the office. What can you do for your nutrition? And not for like a guilt-based intervention, like, oh, you should be doing this, but just, hey, let's get you involved in it. Like when you're at home, what can you do?
Do you think they already thought that you may have known that because you were a doctor? Okay. I wonder. I mean, they're not saying it to anybody else either, but I'm just wondering if maybe.
Exactly. I was just about to say that, although based on my experience.
Yeah. I was just curious. So what was your journey? Share that with our audience if you don't mind.
Yeah, no, not at all. So I went intuition, 6 months, went to my regular OB-GYN, told her, we've been trying for 6 months. And of course, she said the same thing that I'm sure everyone in your audience has heard. Tried for a year, still nothing. Got sent to the REI. Of course, they did the whole full workup, which, I mean, HSG is still very traumatic for me, right? I don't think we prepare our patients well enough for that type of procedure. And that's one of the few things I remember, which is not.
I'm sorry. Yeah, it's
right?
not pleasant.
Yeah. So got diagnosed with fibroids. They wanted to remove it. At the time of removal, got diagnosed with endometriosis. Of course, he's not, an endometriosis excisional specialist. So, but he removed what he could. And then after that, went through probably 10 IUI, failed artificial inseminations, started doing embryo banking, was diagnosed with diminished ovarian reserve.
How old were you at this point?
Oh gosh, I was 31 when we started everything. Yeah.
Okay. So they couldn't use your age as an issue, which for those of us who start later, that's like the default. And what I say to people is we can talk to people that are in their 30s or their 20s that have the same issue. So don't necessarily put all your eggs in it being your fault because of your age.
Exactly.
All day long, we can talk to people that are younger that are going through the same thing.
Yeah. My AMH was 0.3 at 31. And of course, you get that, this is unexplained why you have diminished ovarian reserve, which is what I love so much about my practice and what I do right now is just being able to help patients find those root causes and actually see AMH levels increase.
Right.
It's just a beautiful thing when you're told that for the REI that's not something that will improve.
Yeah. Can we just say that again? Because I think people get that number from the REI and think this is it. I'm done. There's no option. And like you just said, I see it all the time too. It can increase and it will increase based on doing certain things. So I just want people to understand that just because it's that number one time doesn't mean it's going to stay that way or continue to decrease.
Exactly. Yes. So then had complications with the IVF medications, developed idiopathic thrombocytopenia. So my platelets got as low as 18,000. So had to put a pause on
for
IVF.
no random reason, I'm assuming, with the idiopathic.
Right.
Okay.
Idiopathic. I mean, obviously, I think it was a side effect of the hormonal medications. But yeah, idiopathic. So we waited until that resolved. And then we did another round of IVF. I probably had 3 failed IVF transfers at that point. Went to go do a retrieval, and I'd only brought up 1 healthy appearing follicle. So my doctor told us he wasn't going to sedate me to try to retrieve that 1. We changed it to artificial insemination. That was so my oldest was born when I was 36. So I conceived when I was 35. That was the first month that I decided to listen to this one patient who I thought was really annoying, because every time she saw me, she talked to me about acupuncture and how I should try it. So at that point,
right.
4 years in, I was like, fine, why
May
not?
As well.
And that was the first month that we, of course, having no expectations that an 11th IUI was going to work. And we conceived our firstborn that way.
Amazing.
Yeah. So, and then we had twins from 2 frozen embryos, both of which were not great grades, which is why my doctor said to put both of them in, because he didn't think that either one of them was going to take.
Surprise.
So, right? And I realize that now in saying it, like, my story is such a testament to the improbabilities,
Right.
The expectations that this common thing is going to happen or this common thing is not going to happen. And so that's some of the work that I do is, hey, suspend your belief in what you think you know, and let's really
100%.
personalize something for yourself.
100%. It's possible. And I think sharing these stories help people to not give up hope. I always say the more that your desire is greater than the fear, you can continue to go on. And the more that you hear these stories of, oh, that's not how it was supposed to go, or the 11th IUI, oh my gosh, okay, then maybe it's possible for me too. Or the 2 embryos that were not graded. Like, all of these are so important for people to hear, because you get so much negative input that it's rare to hear the good side of it. So
Absolutely.
Thank you for sharing that.
Of course.
And so how did it all bring you to, so you have twins and a single oldest, any more than that?
Yeah. And then
they keep coming.
I know. So our first, after all of the struggles and failures, while we were going through his cycle, we decided to go through the adoption process.
Okay.
And so we completed all the paperwork for that alongside the same time that we were doing that cycle. Well, 2 days after I got confirmation that we had a positive pregnancy test, and I tear up thinking about it. 2 days after that, we get a call from the adoption agency saying that we got matched for an adoption.
Amazing.
And it's bittersweet because we actually, and we told her that we were pregnant. She said, that sounds great. We were going to have boys that were going to be 6 months apart, and the adopted baby was going to be born first. So we prepared his nursery. And the day that she went into labor, she decided to keep the baby.
Yeah. Oh gosh. Wow.
So it was very bittersweet. Right. And I was so thankful that, that afternoon we went to my office and we did an ultrasound just to take a look at our baby. It was hard.
Yeah.
It was really hard. And it was at that point that I was just like, oh my goodness, is this really going? I feel like every step of the way is just roadblock after roadblock. And I totally hate the cliche about everything happens for a reason, but my journey is just like so beautiful looking back on it. And so after we had had our 3 biological children, I just told my husband, I was like, I just feel like that there's still an adopted baby that is out there for us. I just feel it in my heart. And if we do this a second time and if it doesn't work out, I'm okay. And that's when baby Ella came into our lives. We were matched for an adoption with her. She's 4 years old. And I mean, just like our family's complete. It's just amazing.
It's awesome. So, congratulations on all of that. That's
Thank
amazing.
You.
4 kids. Oh my gosh. That's a lot.
It's a lot.
Oh, goodness. Okay. So now, since you've opened this practice towards functional medicine, how did that all kind of change paths? Because obviously being from a traditional MD and all of that, that's, it's not easy to get a traditionally trained MD to even have a conversation about anything alternative in any sort of form. So that's a pretty big left turn. How did that go?
I was always, I think, of the type that I'm extremely empathetic. So I always let my patients, air out their concerns. I was always, if I had to be late for a next patient appointment because one patient was going through it, I let them talk. If a patient brought me information on something that they wanted to do that was safe, yes, I'm going to support you. And so I've always just been of that mindset. And honestly, delivering Ella coming into our lives, really just drove home, that the impossible was possible. And in that time, I said, this is the right time to make the kind of practice that I want for myself and for my patients to make that leap. So I left my private practice of my first baby of 11 years and didn't quite know what I was going to do. Took a 6-month sabbatical to figure it out and haven't looked back since then. It's been an amazing experience.
Congratulations with all those little ones under your belt and jumping into something else. I feel you and congrats to you. So for people that are listening, can you describe the functional medicine in the context of fertility and hormonal health and what that means?
Yes.
Because I think there's still some ambiguity around that for people.
Yeah. I think the thought is expensive and supplement heavy is probably the first 2 things that they think about. But
I think you're not wrong.
Yeah, I would say even though I'm functionally certified, I probably lean more to integrative than functional.
And so how would you determine those 2 for people?
Yeah. So integrative is more so meeting in the middle, right? If we want to use something like Clomid or Letrozole because, you're anxious and you're ready to be pregnant, hey, let's use it. It has a good safety profile. Let's add that in conjunction with, hey, let's talk about stress management. Let's get you to an acupuncturist. Let's just do basic things like tracking your fertility with a fertility monitor, seeing how we can optimize timed intercourse better. And then if we need to bring in a few key supplements, let's do it with a personalized approach,
Right.
How can we get some basic labs to look at your vitamins, your antioxidant needs, and make that more educational and personalized for you?
You're speaking my language. I feel like there's, again, so many people that they don't bridge that gap between the both. And I feel like we can't keep having 2 separate conversations without one acknowledging the other. And I see so many people that are over supplementing, especially for the place that they are in their journey, that it's like they're doing themselves a disservice. But in their mind, they're thinking, I can't let go of any of these supplements because what if this is the thing? And I'm like, that supplement is not going to be the game changer for you because you're at this phase. Like you've passed that point or you don't need it based on your labs. And I think people don't understand that because when they go to their regular RE, they don't, well, they're not taught about that, first of all. So that's not their jam, but also they don't really want to get into that unless maybe they're selling their own line of supplements for some reason.
Right.
So I love the fact that you're acknowledging that because it's out there, people who are Googling fertility and what to do, that's the first thing really that comes up for them is supplementation. And unfortunately, they end up taking way more or maybe not the correct dose, or they think, well, I'm taking a prenatal, so I'm covered, but no, that's not going to cover you. You need more than that.
Exactly.
So what are the most common misconceptions that you find in your practice now for patients that rely solely on conventional medicine for reproductive health?
I think one of them is that, which I'm sure you talk about with all your patients, just that traditional 28-day cycle that, I should be ovulating on day 14. And that's just, so many women that I see, like such a basic thing, right? To teach them how to track their cycles correctly.
I know.
And
it's
with
like
the devices,
criminal, I feel like why aren't we doing this in school?
Right,
it's ridiculous.
Right? Or at the first gynecology exam, or setting up a preconception visit to educate patients on that. Yeah. But with, amazing, tracking apps, tracking devices that we have, that's something very cost effective that patients can do. That's a common misconception for sure.
Is there a particular app tracker that you like for your patients?
Yes, full disclosure, I do social media work for them, but I actually found them when I was doing a podcast, and I spoke so highly of them on my podcast. I did a comparison of the different fertility monitors that were out there, that they asked me to do some social media work for them.
Awesome.
But I've been using or encourage my patients to use the Inito device, INITO. For almost the last 4 years now. I have patients literally, today I probably have 3 patients that sent me secure text messages with their charts, and we're able to review them in real time. So I'm able to give them a pep talk like, oh my gosh, that's an amazing estrogen level, or okay, we're just waiting for that progesterone to rise. And we can see the trends and how that's improving each month based on the interventions that we're doing.
Yeah, it's amazing, I think. When my patients first started using some of the vaginal ones, it's like I think I had right out the gate 2 that were over 40. Yeah, it's been so long now, but that got pregnant right away just because they were seeing exactly what they needed to see. And same as you, I can't speak highly of it because I feel like we have the technology now that has the ability to do that. And I think people were worried about the security, and you just mentioned that too. They're all, obviously you have to look into whatever one you're going to use, but most of them are very locked down on security and encryption and all that stuff. So no need to worry about that. So what role do you believe nutrition and stress and lifestyle truly play in the fertility space?
100%. 100%. Yeah.
Yes.
And how we do our practice is very much how you practice. It's a team base. You get access to a health coach, you get access to a nutritionist. I'm certified in lifestyle medicine, so if you can't afford those add-ons, I'm here to talk to you about nutrition and to help you through it. But it is extremely impactful, and I often tell patients hey, right now, we're working with the mindset that you already have a baby in front of you.
Amen.
That baby's in the high chair. So what are you going to feed that baby, right? And everything is 80-20. And we don't
I have goosebumps just hearing you say that, because that is half the battle, Roxanne, is having somebody who believes that so deeply in their core for you, right? If you have someone on your team that is saying that to you compared to the alternative, you are so hopeful. And just that idea of hope that you're holding the space for that is a game changer, literally.
Yes, it really is. Thank you. But yeah, that's how we're, and this isn't hocus pocus stuff, right?
I know.
Like, this is evidence-based. And this is unfortunately what REIs, what your general OB-GYN does not have time to talk to you about. Okay. Whenever I was in my last practice, I had orchestrated them hiring a dietitian, which was a game changer. And then when I left, they let her go, you know? So I think that having someone like you, someone like me on their team is really, really a game changer for sure, to talk about nutrition and stress management. We know that we have good studies on, even that mindset, being hopeful, can improve outcomes for conception, and so I really love being a cheerleader and being on a team, kind of a team-based approach for that.
And the research is out there. I feel like people just don't dig to go look for it for all types of things, whether it's cancer or heart disease or fertility or whatever. Like, we know now that the mind-body connection, it's a real thing. Exactly. And so I think there's this whole new wave of doctors that are open to understanding that, and not to downplay the older guys that are leaving the industry. But I think that the doctors that don't get on board with that are really going to have a hard time communicating effectively to their patients, because it is this new collective energy of like, oh, okay, not only should I be doing this, because I really do believe in the medical side. There's many experiences where we need the medical side. We can't just say we're just going to go holistic and natural and whatever. As much as we would like to think that, that's not the case. And I think we're going to continue to have more issues around fertility, but that is why it is so much more important to have that bridge between science and spirituality or soul or emotion or whatever you want to coin it. I think it's imperative at this point.
Exactly.
So you mentioned being symptom-free of endometriosis and fibroids without surgery or hormones. What daily practices have you found most effective in your healing?
Yeah, so I mean, and that's another misconception, right? Endometriosis, how much it goes undiagnosed. And I think for so many women, if you have infertility plus pain with sex, pain with periods, heavy periods, advocate for that diagnosis, or talk to a health coach, talk to a functional practitioner about interventions that you can do to help reduce that endometriosis. And so for me, it was diet. And I think, like in your experience, right, everyone is different. There's no protocol. Don't eat this for fibroids. Don't eat this for endometriosis.
Right.
I had to trial and error. I had to figure out what were my triggers. And since then, and it's not like I avoid them all the time, but I know that if I'm on my period and I have chicken, I will immediately have bad cramps. It's just wild. So that's one thing.
Again, I love that you say that, because something like chicken, people think is so innocent, right? Like, we all eat chicken regularly, most of us, and it's not a problem, but it's everybody's specific body and what they react to and what's going on inside of them. So I may not have the same diagnosis as you or Susie Q, but if I'm just watching you and kind of self-diagnose around that, I feel like that's where we get into a little bit of trouble. And so really going back to your doctor or whoever you're seeing on your journey to help you to make it specified for you, because that's going to be the game changer for you, not just a standard protocol that you read online or that you saw someone else do, because that may not be the case. Like, I had fibroids as well. Given my age and where they were, I had to have them surgically removed. I couldn't nutritionalize my way through that in the time that I would have needed to have a baby. I was already 40. So I think everybody is different. Take your own case by case, but know that everything is possible. So it just depends on where you're at and what your story is, and talking through that with your doctor to see what is it that I can do to help mitigate this when I need to, and or if we're really at game day, what needs to happen in order for pregnancy to occur. So
absolutely.
So now that you're a mom and a wife and a doctor and a daughter and all the other things, what do you do to help find? I don't like to use the word balance for my own life because I know there's just no such thing. But how do you find that groove that works for you?
I acknowledge that there's always going to be mom guilt. Mm-hmm. And I acknowledge that I have some level of imposter syndrome, right? I want so much for my patients. And sometimes I don't feel like I'm good enough or I can, help them in the ways. And I think that that's a very important thing to acknowledge for myself, because it does keep me in check. It keeps me humble. It keeps me able to tell a patient when I'm no longer able to help them and when they should move on to a different provider. And I think that humility and empathy are two big things that we're missing in the conventional space that we need to bring back. But especially the mom guilt, I think that most therapists will say that taking care of adults, that they have equal parts. My mom was around all the time and she smothered me, and my mom was never there and she abandoned me. So I think my kids are probably going to have something to say in therapy. I feel like I had a great childhood, but I could probably air my grievances too. And so in that mom guilt, suspending that, what about me? How can I take care of myself and not feel guilty about that, knowing that I'm taking time to exercise, and it is away from my kids, but I want to live to be 85, 90. And so I've got to put in that work. I've got to make some sacrifices.
And I think it's also, from my experience too, because I feel like I'm in the same boat, it's letting them see what's possible for us and for them too. And I'm sure your kids are so excited about what you do, because mine are too. And they just think it's the best thing ever that we get to talk to people about babies and help them bring in babies to the world and all that stuff. So I have no doubt that they're super proud of their mama in the work that you're doing. So
thank you.
Any last advice for people who are listening that may be going either mid-journey or just starting out?
I mean, don't give up. Like, those are 3 words that I probably say at every fertility appointment. Do not give up, knowing that inherently our journey is for good. It's there for you, but you don't know what your journey is going to be, and you don't know how you're going to truly become a mother. And I often say I love being able to say that I have 4 kids and none of them were the natural way of becoming a mother. And sometimes when you work really hard for something, you just cherish it so much more. But just to never give up.
I couldn't agree with you more. And I think having that person to remind you, who especially is the doctor on the other side of the phone or in front of you or whatever, is so key, because you realize that you're being seen and you're not just a number, and that they want you there for the right reasons, not just to kind of string you along, so to speak. And your story is such a testament to that, because you didn't give up, and look at your beautiful family that you have now. That's amazing. Yeah. So how can people find you, get in touch with you, work with you? Do you see patients that are outside of the state? Like, tell us more about that, because I'm sure everybody wants to get more of you.
Yeah. So I'm in Dallas, so I will see anyone in the state of Texas. I do have a license in Oklahoma, Louisiana, Colorado, and California. And I will have patients that will message me on Instagram. If you can't get in with me and you're a fertility patient, message me on Instagram. Like, I will help you get in sooner. Those are big priorities for me, is to take care of fertility patients. And so I want to help them. And if I can't help them, if I just can't get them in when they need to, then I promise I will help them find someone else in the meantime. I'll send them to you, Elizabeth.
Well, that is so kind that you, again, I feel like the sincerity behind your yearning to help and the mission is like this bigger collective energy I can feel from you of like wanting to help women on their journey. And that's so beautiful. So thank you so much for your time today and being here, and look forward to connecting with you again.
Oh, thank you so much.
Thank you for joining us on this episode of Friends with Fertility. We hope that you found the stories, insights, and tips as inspiring and informative as we did. Remember, you are not alone on this journey. Your friends with fertility are here for you. If you've enjoyed today's episode, please subscribe, rate, and leave a review on your favorite podcast platform. And don't forget to follow us on social media for updates and more fertility resources. Until next time, stay hopeful and keep believing in your journey, and know that we are sending you lots of love.